Hi, first of all, good morning, good afternoon, and good evening to all of you. Very briefly about myself, I am Nilanjan Bhor, connecting from Bangalore city of India. My talk is about behavioral adaptation to physical activity and healthy dietary choice, a planetary health research agenda. To begin with, I will set the background first. Government's lack of engagement and lack of transparency towards improving systemic changes such as food system by reshaping the structural, political, and institutional dimensions led to gaining prominence of individual and household level behavior change interventions. Adapting with physical activity and a healthy diet are the two very common behavioral factors for addressing climate change and as well prevention and management of non-communicable diseases, in short, NCDs. But adaptation to these factors are very challenging for those who are already affected by health inequities, especially those living in urban areas due to the increase in social and environmental effects of rapid, unplanned urbanization and globalization. My research has attempted to understand the challenges faced by these urban vulnerable and disadvantaged groups in adapting with the maintenance of walking and diet from individuals who are diagnosed with hypertension and diabetes and residing in a low income neighborhood. The findings of this behavioral adaptation are drawn from the big urban health research that attempted to investigate how individuals with non-communicable chronic conditions perceive their health and practice healthcare seeking by interviewing 20 individuals from the same neighborhood. In this research, physical activity is confined to walking and healthy dietary choice is confined to adhering to the NCT appropriate diet as advised by the treating physician to the study participants. I'll take you through the findings. The findings reveal that adapting with the maintenance of walking and NCT appropriate diet was difficult by the study participants due to the underlying individual, socioeconomic, and environmental determinants. Very briefly, the individual determinants are mostly affected by the episodic nature of controlled and uncontrolled state of hypertension and diabetes. The socioeconomic determinants showed a direct impact on limiting or stopping walking and non-adherence to the NCT appropriate diet. The environmental determinants are mostly affected by walking. However, participants were more concerned about or aware of maintaining NCT appropriate diet than walking, as the majority of the participants experienced that non-adherence to the appropriate diet ended up with uncontrolled or increased blood pressure and or blood sugar level that led to participants to visit a doctor immediately. Very few participants found that walking was comfortable and relieved their physical discomfort. Therefore, adhering to the maintenance of walking and density appropriate diet is difficult without promoting determinants of health inequities. I'll take you through the conclusions now. In conclusion, the challenges in addressing behavior change in general in a community as a whole, irrespective of any diagnosis or disease conditions amongst individuals, could also be likely similar and to be addressed based on these research findings. And it requires a planetary health approach, which also considers the structural, political, and institutional dimensions in improving health inequities. Therefore, behavioral adaptation to physical activity and healthy diet without addressing social, environmental, and commercial determinants of health may burden individuals in maintaining the behavior change. Therefore, this study strongly emphasizes the promotion of research on behavioral adaptation to physical activity and healthy diet through planetary health approach. I hereby conclude my presentation. Thank you everyone for listening to me, to my presentation. Thank you.